The idea of a coaching triad is the idea of the physician, the coach, and the health coach or the health and wellness coach, and the client. And I think it really is coming about as we're struggling to understand what's the new role in our healthcare system of this healthcare provider that hasn't been there before. Is coaching a new perspective that should really just infuse all of the practice of all kinds of healthcare providers? Or is it really its own specialty or its own field of expertise? And I think the triad gives us an opportunity to really look at both of those things. I think all physicians, and I have the benefit of I not only am a practicing physician, but I teach medical students and residents. I think all physicians, as well as other healthcare providers, can really benefit from a lot of the philosophies as well as some of the tools and practices that we have in health coaching in really shifting the nature of the relationship of how a physician or a nurse practitioner or a PA works with a patient or a client. But I also think that there really is a role for a new expert is kind of a funny word, a new skilled practitioner whose sole role in this system is to really be the coach. And that is the person that is side by side with the client who is deciding what they want, when they want it, but is really looking to the coach for guidance and support in how do I actually manifest the changes that I feel ready to make, that I want to make, how do I discover what changes I might be ready for. And to have that coach be someone that really works closely side by side with the physician or the other kind of healthcare provider that is really providing more of a content expertise to the client. So a physician or a nurse practitioner might tell a client, boy, it would be really good for your health to lower your blood pressure, or it might be really great for your health to lower your cholesterol or to lose some weight. Beyond that, most of us as physicians aren't really trained to know how to help a person achieve those things that we're recommending to them. And that is true in the alternative and integrative world in the sense that a naturopath or an acupuncturist might make lifestyle recommendations to a client, but they may not have the time availability or expertise to really work on a weekly basis or a frequent basis to help a client be able to achieve what they want. And I think that really is the role for the coach in medicine and in healthcare as we have it today.